Hi everyone, I'm Dr. Julies Fatima and I own the clinic in the name of Small Smile Studio. And on behalf of Small Smile Studio, I've come up with something very important, and that's about Space Maintainer. I've already made some videos regarding Space Maintainer. I'll put the link to those in my description box. Today I'm going to be discussing the individual kinds of space maintainer, and the one that I'm going to be discussing today is the distal shoe space maintainer. Now, as you can see, all these different scenarios have one thing in common, and that is the malaligned or the improperly arranged teeth in your child's mouth, which is why the teeth look crooked, they are unsightful. In some cases, parents complain that why are they so ugly looking. Now, as a guardian or as a parent, our first question is, why did this happen? So this happened because the primary molar or the molar in the milk teeth set was lost prematurely or was lost before it should have been lost, either because of some decay or cavities or trauma, the child fell, whatever. Now what happened? The tooth below that milk tooth that was lost prematurely, it was not ready to come out in the oral cavity, right? Now the space was left empty. So the permanent tooth that was sitting just behind the milk tooth that was lost prematurely got a chance to tilt forward and consume the space that should have been left for the permanent tooth to erupt, as you can see, which is the second premolar in this case, which is still sitting silently in the bone waiting for its turn to come up. Now, how can we save our child from this mishap? Now, imagine the moment your first permanent molar, which is the first tooth or sometimes the second tooth in the permanent dentition to erupt, that has not erupted, okay? And your second molar of the milk tooth was lost prematurely. So its counterpart, its permanent tooth bud, has also not erupted. Now in this case, if you do not insert the space maintainer, and especially the space maintainer that is to be used here is the distal shoe space maintainer. If you do not insert this kind of space maintainer, which with its vertical component, as you can see, which is going inside the bone, this vertical component actually guides the permanent molar to not just erupt but erupt at its own proper place where it should be erupting without consuming the space that is to be left for the eruption of the permanent tooth, which is the second premolar here. And if you look at the radiograph, you will understand it better. See, this is my own patient who had come to me, who had extensive decay. The second molar of the milk dentition could not be saved because it was grossly decayed. So we extracted that tooth, we used the distal shoe space maintainer, we banded it, we secured it properly, and over the period of, I think, yes, 9 months later, you can see it has not just saved the space of the permanent second premolar that has to come, it has also guided the proper in-line eruption of the permanent first molar. So you see how important it is to place the space maintainer when it is actually needed, and how with the help of a tiny device you can save your child from such big problems that are going to be reaching or troubling you later. So always act promptly and save yourself from complications And for this, you can always visit us at Small Smile Studio, which is a specialized dental clinic for kids and adults. Thank you so much.